Hi, my name is Jack Knightley. I'm a neurosurgeon here at Maxim Spine. I did my training in the Navy, so I grew up in this area. Went to med school in New Jersey Medical School in Newark. And then after that, I did my postgraduate training in the Navy. So I did my neurosurgical training there and then served in Okinawa, San Diego, various places. Back then you did your internship, and especially in the Navy, because they trained you to go to the fleet. So like my colleagues, they didn't do pediatrics, they didn't do ENT or anything like that. But I had to do all those rotations, so when I was out in the fleet, so I got to see all these different things. I knew I was going to Okinawa for a year, so I rotated on neurosurgery and fell in love with it. When I was a resident, you get to do everything, and then spine surgery was kind of changing, and this is like in the late 80s, early 90s, where neurosurgeons always did spine, but more of the bigger deformity cases, typically done by ortho. We didn't have a lot of the same widgets, so it was a very, very dynamic, it's still dynamic, but it was very dynamic back then. And just the way my brain's wired, I just liked the whole concept of correction of deformities and things along those lines, and understanding how things are built. I just kind of gravitated. I was mostly thinking vascular spine, and then just right place, right time, right mentors. Migrated towards the spine world. I did rotation at Boston Children's Hospital after my chief year, and I got exposed to some other spine people, and it's just like that it clicked. It was like, this is what I was meant to do. Surgery is a big deal. I mean, and again, having had spine surgery, so I think the fact that I've had my neck fused is I empathize with patients all the time. And I think they appreciate the fact that, like, I have this, like, I had the exact same thing, if not worse than you did, so I understand it. I can empathize with you, and this is how I got through it, and this is how we will get you through this, etc. But being empathetic to the patient, I think that's what we do a lot well here at Maxim Spine, is being empathetic to the patient's unique condition, so they can have the best outcome possible. I think most rewarding is when you have a patient comes back in, it's like, you've changed. I can now walk, and whether you're 50 or I can go back and play golf, as opposed to I can walk with my grandkids through Disney World, things along those lines, and you get back to activities that you weren't doing before. Spinal disorder, getting people back to their normal activities. Patient recently just like, I've been in pain for 3 years and I haven't had pain. I'm just so happy. That makes my day. I think our physician is very well trained. I think we don't just, we try and spend time. We all do thorough exams, and it's very much of a team approach. So to see all those patients, whether it's the people see them when they come in, getting adequate histories, from our MAs all the way up to the surgeons, we're all into the same aspect of what drives this patient, and so they can have the best outcome they can have.